Good morning, my name is Binnie and my presentation is titled How Much Are You Troubled with Lack of Confidence in Your Knee? A qualitative study exploring how individuals with knee osteoarthritis conceptualise knee confidence. So it's no doubt that confidence is an issue for people with knee OA. As clinicians, we see this every day. We see reduced knee confidence influencing how our patients engage in movement and activity. We see some patients modifying the way in which they perform a particular task, while others limit or avoid that task altogether. But the research doesn't support this. We have conflicting evidence around the association between knee confidence and function in this population, which is contradictory to what we see every day in the clinic. It makes sense that a lack of confidence would negatively impact someone's function. So why doesn't the research support the relationship between knee confidence and function in people with knee OA? Well, we think it's because of the way that confidence is currently being assessed. So at present, knee confidence is assessed using a single item from the quality of life subscale of the COOS. How much are you troubled with lack of confidence in your knee? Now, although the COOS has been shown to be valid and reliable in this population, it is plausible that a single item measure does not provide an accurate assessment of an individual's confidence in performing a number of different tasks in a variety of settings. And in addition, it's important to note that when the COOS was being developed, this item on knee confidence was actually taken from the ACL Quality of Life questionnaire. So the question's not even been designed for this population. So perhaps the reason that the research doesn't support the relationship between knee confidence and function is because we're not appropriately assessing knee confidence in this population. So we first need to understand what a lack of confidence means to people with knee OA before we can study how knee confidence influences movement and activity behaviours. So we set out to answer the question, what does a lack of confidence mean to people with knee OA? So what did we do? Well, we recruited 51 participants with a clinical diagnosis of knee OA and at least a moderate level of pain-related disability. And we performed semi-structured interviews with them. And we used inductive coding techniques in our analysis to determine what confidence means to these individuals. And this is what we found. So the individual's conceptualization of confidence were related to these 4 domains: symptoms, function, structure, and knowledge. And each of these domains were associated with present and future concerns. So if we start by looking at the symptoms domain, some individuals' conceptualization of confidence was related to the symptoms that they were currently experiencing. So things like pain, instability, and weakness, while others conceptualized confidence as being related to their concerns about their future symptoms. To better explain this domain, I'm going to now introduce you to Kate. So Kate is one of the participants from our study, and her conceptualization of confidence fits within the symptoms domain. So we asked Kate to think aloud as she responded to the question, how much are you troubled with lack of confidence in your knee? And this is what she said. Well, I used to be quite confident in my knee because I found I could still do everything I needed to do, even though the pain used to be quite severe from time to time. So I used to be fine, and I would have said, say 3 months ago, I would have said, troubled by confidence? No, not at all. But since I've had this really major burp 2 weeks ago, where my knee actually really stopped supporting me and I had to go on crutches, now I am lacking confidence a whole lot more. So I have to say with this one, I'm going to say moderately. We then followed on by asking Kate what knee confidence meant to her. So if she was to be 100% confident in her knee, what would that look like? And this is what she said. It means every single time I perform an activity, my knee performs as I expect it to. It doesn't mean there is no pain, but it means that I know whenever I put my foot down in a certain way, it will be the same pain. Whatever pain I experience, it's going to be the same one each time. It's not going to change. So for Kate, her lack of confidence was really tied up in the fact that she had this recent pain episode where her knee behaved unpredictably. So she lacked confidence because she felt as though her pain was no longer predictable. So Kate is someone whose conceptualization of confidence was associated with her present day symptoms, and this fits nicely within the symptoms domain. We also had participants who conceptualized confidence as being related to their present and or future function. So they lacked confidence because they felt unable to perform their daily activities, work duties or hobbies, or because they felt like they were living with vigilance. So they had to really consider the knee when they were doing their daily tasks, or because they felt as though they couldn't rely on the knee because it wouldn't hold up to whatever task it was required to do. So I'd now like to introduce you to Connie. So Connie was someone whose conceptualization of confidence was related to her function and specifically to her ability to complete her work duties, as well as her concerns about her job security in the future. So in response to the question, how much are you troubled by lack of confidence in your knee? Connie said, extremely. I lack a lot of confidence because in my job, my knees are very important because I have to work with children with disabilities and I have to bend down sometimes to help them put their shoes on. I have trouble getting up. So I reckon extremely worried about it. She also expressed concern about her ability to work in the future. I think about it all the time. In my job, I need to have my knees be okay because as an Education Assistant 3, we have to deal with a lot of children with disabilities and have to kneel sometimes to help them do stuff. So if I can't do that, I might lose my job. It's part of my job. So you can see that for Connie, her confidence is really related to her ability to work and to continue to work in the future. So her conceptualization of confidence fits within the functions domain, with Connie expressing both present and future concerns. And now if we look at the structure domain, so these were the participants who lacked confidence because they felt as though the internal structure of their knee was compromised and they were concerned about doing further damage to the joint. And Neville was one of these participants. So his lack of confidence was heavily influenced by his structural beliefs about his knee. He was really concerned about the idea of his knee being bone on bone. And when we asked him about knee confidence, this is what he said. I'm actually really troubled. What I can't get out of my head is bone on bone. That's the image I have in my head. It's bone on bone, and how the hell can that improve? Certainly that's the way I feel at the moment. The only answer to completely stop this is to have a knee replacement. I just don't see any other way around it. I can't get it out of my head. I can't shake it out of my head, the bone on bone. He was also concerned about the bone on bone becoming worse over time. I just feel like it's wearing. The bone on bone is naturally wearing it away. So therefore it's going to get worse. It's not going to improve because it has to be. Two bones of the same material and density rubbing will wear it away. So Neville's whole conceptualization of confidence was related to his beliefs about the internal structure of his knee and his concern about making it worse in the present day and in the future. So this fits nicely within the structure domain. And finally, the knowledge domain. So for these participants, a lack of knowledge meant a lack of confidence. And Ron was one of these participants. So Ron's main concern was that he felt uninformed about his knee. He didn't really know what was going on. He didn't know how to best manage his knee. He didn't really understand the pain, and he was really unsure about where it was heading in the future. So when we asked Ron about his knee confidence, he said the following. I suppose the word confidence, I quite like that word because I feel uninformed, okay? So I am uninformed. When I'm playing golf regularly, which I really enjoy doing, am I doing more harm to my knee or not? Is it a good thing to walk around the golf course or should I be in a cart? So that worries me. He also felt his lack of confidence was related to not understanding his knee pain. So if you've got pain, then you're not confident. You don't know what it is. I mean, it could be a blooming carcinoma in the bones for all we know. You know what I'm saying? So in other words, if you've got pain, so this one here, it's just starting to feel sore over the last month or so. If I jump to the conclusion, well, that's just arthritis. I don't know that it's arthritis. It could be something else. So it's clear from these quotes that Ron's lack of confidence is related to his lack of knowledge. And I'd just like to point out, although I've discussed how the conceptualizations of these four participants fit within the four different domains, there were a number of participants whose conceptualization of confidence was associated with multiple domains as well. So what are the implications of this and where do we go from here? Well, clinicians should explore these different domains with their patients so that they can better understand and address their lack of confidence. And from a research point of view, I think it's fair to say that a single item measure is unlikely to address all of the aspects of confidence in individuals with NEOA. And we really should be measuring the 4 different domains when assessing NE confidence. And once we're able to better assess NE confidence, we should then go on to explore the relationship between the different domains and function, or how people engage with activity and movement. So just to finish up, NE confidence means different things to different people. And it's important to understand what NE confidence means to someone with NEOA, because it's likely to impact on how they move and how they behave. And understanding this relationship means that we can provide better management. But we can't study this relationship until we have a better understanding of the different domains of NE confidence, and we have a way of measuring these domains. Thank you very much.